want to make sure I remind everyone of our mission. So PCOS Together is a research program, and we're really aiming to improve our understanding of health outcomes and healthcare in women with and without PCOS. And I wanted to introduce our team. Some of them are actually on video now. So we have Stara Morning. Stara is administrative assistant and also helps with our clinical studies and does a lot of background work for us. And then we have Dr. Wilk, Wilk, who is really leading the clinical recruitment and clinical handling of all of our heart health study that some of you may have participated in recently. We have Eden Wu or Xiang Wu, who is actually a master's student working on our heart health project at the moment. And we have Letisha Hodges, who's actually our registered dietitian tonight, who's hosting this dietetic piece of the show tonight. And then we have our patient partner, who is Way-Olenek, who has been a great support to our research group to help us with grants, helping us with advocacy for women with PCOS. So thanks to Laura. And that's our team. We're a small team, but we try to do a lot of good for everyone in our research program. So the aims of this community forum, and I also forgot to say our resident endocrinologist for our PCOS Together program is Dr. Mahua Ghosh. She is in clinic and will join us a little bit later if you have any questions for her as well. So the aims of this community forum are really to outreach and engage with you, our PCOS community, to inform you, but also learn from you as well, and then to translate from you and what we learn into information tools and resources that we can put on our website and help those in Alberta, in Edmonton, with PCOS. So today we're talking about nutrition. I'm going to cover nutrition guidelines and research, a quick update. And then Laura, our patient partner, is going to do her food and health journey. And then Letisha is going to really focus on health and nutrition from a registered dietitian's perspective. And then we're going to have a question and answer where everyone can enter their questions in the chat. If you can do those in capitals in the chat box, that will help us really focus on the questions as they come in. And Mish will host the question and answer session for us. And then Letisha and I, and even Dr. Ghosh, can answer questions as they come in. So I think that's all of the major points I wanted to make initially. Also, just to remind you, this is a community outreach forum, and we're not giving specific individual medical advice. Just to remind you of that, this is really a general forum for our community. So if you are seeking individualized medical or dietetic advice, we really would ask you to contact us later if you have really specific requirements that you need answered as well. So why do we study PCOS? PCOS incidence is between 10 and 15% of the female population globally, and even higher in some populations. It's a multi-system disorder with reproductive, hormonal, emotional, mental health features, and it really results in altered health-related quality of life across a woman's lifespan. And it's one of the most misunderstood, understudied, and underfunded diseases compared to other diseases like type 2 diabetes, obesity, cancer, and heart disease. And one of our major jobs in research is trying to get funding to doing our research. So that's a big part of our job. And those with PCOS are at higher risk for type 2 diabetes, obesity, heart disease, and many other disorders, which we're not covering all of those tonight, but we will focus on the risk factors for these as it relates to nutrition. We need a lot more evidence-based research to better inform those with PCOS and improve healthcare, particularly in Alberta and Canada, which is what we are all trying to do. So our research from current studies I haven't listed our previous studies, but some of you may have been in some of our previous studies, like the Fisher Metformin study. Currently, we have a heart health in women study in women with and without PCOS. And that's running through the Mazikowski Heart Research Institute, and also is funded by the Women's Health Women Health and Child Research Institute. We're also looking at understanding healthcare and nutrition services in PCOS, which is a study you can also participate in. And we're also looking at health outcomes in women with PCOS, where we're actually working with the health databases to look at the incidence of all different types of disorders in women with PCOS. So I wanted to focus on nutrition and our current research findings. We did a dietary intake assessment in high-risk patients with metabolic syndrome and PCOS. We did a diet nutritional assessment with a registered dietitian based on 3-day dietary records. And then the patients actually received healthy eating and dietary counselling from that registered dietitian over a 3-month period. And what we found from this study is that in general, women with PCOS that we looked at in this high-risk group, and that's where we've been working with these high-risk women with the metabolic syndrome, so have obesity, insulin resistance, and PCOS, they had an overall low healthy eating index, which takes into account all the foods that you eat across your diet and nutritional intake. So it's meant to be 100, but their mean healthy eating index was 53. And so when we saw this data, we thought, well, women with PCOS that we're seeing seem to need help with their nutritional supports. And certainly that's what we've been finding. And we also found that around 55 and 50% of women had greater than the recommended energy intake or kilocalorie intake and sugar intake to meet their energy requirements. And if we look at just this blue line, this is a spider web plot. This blue line here, this is the overall healthy eating index of these women. We found that they were eating empty calorie foods. They weren't eating enough refined grains. They weren't eating as much whole fruit and vegetables as we hoped, and whole grains, less dairy than we would have liked. So we really, just from this initial study, we realized that women with PCOS really needed a lot of nutritional support and advice. So these particular women went on to get help from a registered dietitian in this study. Further to that, what we've been doing is a healthcare survey assessment of nutrition and all other healthcare services in PCOS. We have greater than 200 responses, and we're looking for more responses, and you can go to our website to participate in this particular study. But our expected outcomes are really to provide evidence from the healthcare system, from our women with PCOS, to improve their healthcare and nutrition needs, and to do that via our healthcare system and how we do that. So that's what we're trying to achieve with that study. What we've found initially with our pilot data from this study is that nearly 93% of women with PCOS don't get referred. They don't get referred to other healthcare professionals. So you can see here very low referral rates. And then over here, the referral rates to dietitian, for example, which is what we're talking about tonight in terms of nutrition, less than 9% get referred to a dietitian, and less than 2% get referred to an exercise specialist, and 0 get referred to a psychologist if they need some counselling or other support systems. So I need to now address our international guidelines, and this is the Androgen Excess and PCOS Society. They are the global leaders in research and guidelines in this area. And I wanted to highlight their guidelines for the audience, and then Letisha may be referring to these as well. So these are the official guidelines based on a lot of research and synthesis of the research, so evidence-based research. For every recommendation the society makes, They do a complete review of the literature, clinical trials, case control studies to come up with their recommendations. So this is based on extensive review of clinical trials, literature, case control studies to make sure we have the recommendations. So this is like official recommendations. And we use these as a guide, and we are also in the process of updating them as well. So in the initial instance, once a PCOS diagnosis is made, there is also recommendations for assessment of global heart disease risk and type 2 diabetes risk. All women with PCOS should be assessed for cardiovascular risk factors and their global risk. And the risk factors include obesity or overweight, and we would measure weight, height, waist circumference, and body mass index. But also importantly, we also would like to measure body composition, which tells us about body fat and muscle and actually your body type. And that's really important in terms of nutritional assessment and nutritional intervention. It's also recommended your blood fats or lipids get measured. And that can include triglycerides, your LDL or low density lipoprotein, your HDL or high density lipoprotein, which some of you may all be familiar with. And there's some other markers now that we measure, for example, in our heart health study called ApoB, which is a protein, and another non-HDL cholesterol, which is specifically involved in cardiovascular disease as well. And we also measure those. Also, it's important you get your glucose, insulin measured, and sometimes you're referred to have an oral glucose tolerance test as well. You should have your physical activity assessed, and this is actually related so get your heart rate to risk of heart disease and diabetes, and then they will be assessed and monitored.
Hi, it looks like Donna.
Hi, can you still see me?
Yeah, but you lost connection.
Oh, okay, I'll share again. Here we go. Can you see that now?
Mm-hmm.
Oh, sorry, I don't know what happened there. So the guidelines at the moment include healthy eating, and that's a broad term, and Letisha will go over more about healthy eating. But this is implementing a balanced diet approach following general population guidelines. Remember, these are international guidelines and are applying to the global PCOS population, and guidelines differ from country to country and in different populations. So there's no specific diet or energy equivalent diet recommended. It's recommended that we just have a balanced, healthy eating diet. There's been hundreds and hundreds of diet studies done in PCOS, and this is the recommendation. There's no specific diet. And we talk about keto diets, high protein diets, low carbohydrate diets, or glycemic index diets, but really there's no specific diet. It's all about healthy eating and a balanced diet. The guidelines are really to tailor diet to meet individual food preferences and allow flexibility, avoid unduly restrictive and nutritionally unbalanced diets, healthy eating patterns and habits, portion control, regular meals, and also to avoid calorie-dense, nutrient-poor foods. And it's also recommended that individuals seek advice for their specific PCOS and their specific nutritional requirements through a registered dietitian or nutritionist. So they're the current recommendations for healthy eating. Healthy eating also comes with body weight management in all PCOS patients, and this is another recommendation to prevent weight gain, to have modest weight loss if necessary, and to have weight loss maintenance if required. And there's also a focus on improving central body weight, or that abdominal body fat, which is also related to insulin glucose metabolism. And in these situations, the guidelines recommend losing around 5 to 10%. And this is flexible to help really manage that weight and insulin glucose indices so that we can prevent any transition to type 2 diabetes. And this may include a dietary energy deficit of around 30%, but obviously a diet nutritional assessment would have to be done first, and I'm sure Letisha will talk about that later. But all of these lead to improvements in body composition, weight, insulin glucose, ovulation, fertility, androgens, and also quality of life scores, which I'll mention a little bit later. Another really important aspect in the recommendations is physical activity. And for weight maintenance, it's suggested 150 minutes per week of moderate activity and 75 minutes for vigorous activity, for example. And this resource is through the Androgen Access Society and on our website as well. And then there's weight loss and increasing the moderate activity and vigorous activity. And so this exercise is very important for body weight maintenance, body weight loss, and also for quality of life. Further to that, there's recommendations for ongoing assessment, monitoring, and supports for PCOS patients so that they have measurable, achievable, realistic, and timely assessment, monitoring, and supports to help them with goal setting and self-monitoring. And the aim is really to improve the patient's care, their own care, empower them, and improve their global health and quality of life. And that's the aim of the guidelines to do that. So I also wanted to just touch on the prevalence of disordered eating and eating disorders in PCOS. It's a very interesting area because there is a higher incidence of disordered eating and eating disorders in PCOS. And these can lead to malnutrition. They're actually associated with dysregulation of the hormones in PCOS as well. So your testosterone levels, your insulin levels, your gut hormones that are feeding back to your brain and your feeding center. They're also associated with anxiety, depression, your body weight, your metabolic health. And these disorders can also have lower health-related quality of life scores. I wanted to highlight these because we also recommend screening for these disorders and then counseling from a registered dietitian, nutritionist, and for psychological support as well. There's really a lot of support needed for women with PCOS in general, and also in particular if there is an eating disorder as well. So it's good to acknowledge that those exist and be aware of those. So overall, when we look at all the different studies of lifestyle, diet, exercise, and behavior interventions, when we do a complete review of all of these studies, which the guidelines are based on, we get improvements in all of these areas. So body indices, so maybe body weight, waist circumference, your body composition may improve. You can get improvement in your androgens, so your testosterone levels. You can get improvement in your hirsutism scores, and all other aspects related to body hair growth and other androgen excess problems related to PCOS. You can improve your blood lipids or your blood fats. You can improve your blood insulin and glucose. And importantly, when we do these interventions and aspects of these interventions, it's been shown that we definitely improve quality of life, and that includes emotional, health-related, and also infertility if that's a focus of the individual. So these guidelines, again, are very broad and for large populations, but we also apply them to the individual as well. And all of these aspects have been shown to improve some aspect or multiple aspects in individuals with PCOS. So that's just a brief overview. If you would like to put questions in the chat for later related to these guidelines, please do. The next piece of this particular session is really to introduce our patient partner. And Laura is going to talk about her journey with food and health with PCOS. So now I'll turn it over to Laura where she can share her experience. And again, if you have any questions, you can potentially start putting them in the chat in capital letters. So thank you everyone for listening, and I'll hand it over to Laura. Thanks, Laura.
Thanks, Dr. Vine. Hello, everyone. My name is Laura Way-Olenek. I was diagnosed with PCOS 12 years ago, and I'm just here to share with you some of my experiences I faced during my journey with PCOS. So please note that I share with you today is not medical advice. Each person's health is unique to their own situation. If something resonates with your journey today or with my journey and my discussion today, and you'd like to connect with me, please reach out to the UofA PCOS Together team and they can coordinate getting in contact with me. So during my PCOS journey, I have experienced many trial and errors, so to speak. When it comes to creating and maintaining a positive outlook on food, weight loss, and PCOS, I will say it has been a challenge. Over the past 12 years, I've watched my body gain and lose weight several times. Therefore, I'm hyper aware of my feelings towards my body. At this current stage in my life, I'm fighting more than ever to lose 50 pounds of excess weight I've gained, again, for the third time around in my life. I'm very aware of my body's insulin resistance due to PCOS, and I'm again on metformin for the second time on my PCOS journey. The first round of metformin was due to my diagnosis of PCOS while attempting to become pregnant with my son. I struggled with conceiving and completed several rounds of Clomid and metformin before conceiving my son via IUI. I used to joke with my husband that I had an affair with food. I absolutely have a love-hate relationship with it. While being diagnosed with PCOS and trying to get pregnant and working through so many other issues like depression, anxiety, weight gain, I looked at food as a savior. Food is not just a physical attribute for me, it's just as much emotional and cognitive as it is physical. I find my food cravings are extremely strong and it can be difficult to combat them. I took comfort in being able to taste satisfaction, and that was what food did and still does for me. I love to cook. I am a pastry chef and a baker by trade. Luckily, I've learned some PCOS food do's and don'ts that have worked for my body along the way. Like avoiding gluten and refined carbohydrates such as white breads, pastries, etc. Fried foods, which absolutely kills me because I love French fries. Sugary drinks like soda, pop, juices, etc. Red meat in excess. I can have 3 to 4 ounces per week, but I have inflammatory joint pain as well. And red meat really exacerbates that joint pain. Dairy in excess. I drink almond milk and try to select goat milk cheese products, but I really like cheese. So cheese is life for me. It's one of the small joys that I say to myself, you know, I know it's not great, but I need to have some little things. So cheese is life. I do avoid soy products as well. And lastly, coffee. I am still working on kicking the habit of coffee. There are some days where I just absolutely need to have that coffee or that latte, but I do my best to try and stick to tea instead. Reduce caffeine tea, I should say. So I have added to my diet leafy greens like spinach and kale, broccoli, nuts and seeds, lots of berries, strawberries, blueberries, blackberries, gooseberries, legumes and lentils as much as possible. I've traded out most of the pasta for the lentil pasta or black bean pasta where applicable. I'm allergic to fish and seafood products, so I do not eat fatty fish in order to get a source of omega-3, but I have found a vegan omega-3 tablet substitute that I do take. I do take daily supplements containing turmeric and ginger as well. I do find that exercise is a must. I absolutely hate exercise. It's basically my nemesis. But I've noticed it really does help me feel better and have more energy. I think I hate exercise because I suffer from such bad joint pain and horrible negative experiences I've had in the past. You can only hear the words exercise and go on a diet and you'll lose weight so many times before you break down and eat an entire bag of Oreos and then hate yourself later for it. I've been on every diet plan, Weight Watchers to intermittent fasting, and I'm a large proponent of just move around and eat things in moderation. I feel that you don't need to be a weightlifter or a marathon runner, and you don't need to starve yourself. I've made a commitment to myself to work out 1 to 2 times per week at an hour a day. And I do work with a trainer just recently over COVID who has experience with managing diabetes and joint inflammation restrictions. So that's been really helpful for me. I'm aware of my food habits and I try not to punish myself by deprivation. I drink 2 liters of water every day, which is really helpful just to flush my body. I bought myself a standing desk, which I admittedly do not use as much as I should. The standing desk lends itself to just move around. In my teenage years, I struggled with negative thoughts and feelings surrounding my body image. Along with several traumatic experiences, my emotional well-being and my body hit a slump. I turned to food to make myself feel better. And I realize now in middle age that food replacement is not a replacement for feeling good. So being an adult with responsibilities and expectations and kids and negative self-talk, as well as combating PCOS on top of being normal life, has been challenging for me. Now that I'm a mother of a daughter, I'm much more aware of how negative self-talk affects her and her future self-esteem. I've also started watching her for early symptoms, as I've learned that PCOS disease can have a genetic component to it as well. I recognized several symptoms in 2017 and was diagnosed with generalized anxiety disorder. I was prescribed an anti-anxiety medication that only lasted about 3 weeks due to adverse reactions. With that diagnosis, I began researching alternative medications and treatments for my anxiety. I found great success with CBD oil therapy, which has helped my anxiety significantly. But the downside is I do become snacky. So I am much more aware of making healthier choices when I am snacking. There's some days where I just feel that smaller meals are better. And there's other days where I do stick to my 3 square meals a day. It just depends on where I'm at in my day or in my routine or whether life is busy. I'm much more aware of making healthy choices when it comes to food. I'm also engaged in eye movement desensitization and reprocessing therapy, or EMDR, which most of you probably have heard it as EMDR therapy, to neutralize negative thoughts and feelings and strengthen positive thought patterns for myself. EMDR is supported by your body's natural healing process and allows our mind to identify meaningful experiences. EMDR therapy has helped me improve my quality of life by stopping negativity from thoughts and experiences from interfering with my past or my present and my future. I mentioned EMDR because I found during my sessions that most of the trauma in my past is largely related to my physical size and weight. One of my end goals with EMDR therapy is being able to identify and maintain a healthy relationship with food while maintaining positive self-talk. As I get older, I notice what I believe are underlying PCOS issues such as diabetes, high blood pressure, and cholesterol, and the anxiety becoming more apparent. Each one of those issues is a separate battle. But I do believe that my body is like a little mini ecosystem, and when everything is in sync, it's great. But as soon as one little item changes, it throws everything else off balance. Weight is one of those parts of that little mini ecosystem, and it affects several other things for me particularly. I try and keep a healthy balance between eating in moderation, getting ample exercise, and a lot of sleep, as well as engaging in self-care, and those are some of the cornerstones that I use for PCOS. In self-care for me, that sometimes looks very, very different from day to day. And I really try and make sure I maintain my mental, my physical, and my emotional self all together as one unit. I find that if one of those things kind of goes off track, the other items are affected. So I do my best to try and maintain all those items together to make sure that I'm a happy, healthy version of me. And that's kind of it in a nutshell. Thank you everyone for listening. I know our time is precious here on earth, and I'm a big proponent of ensuring I make each and every moment count. So thank you.
Thank you, Laura, for sharing. As you can see, Laura's had a long journey and she's tried lots of different interventions. And there's already a question for her in the chat, but we'll answer all of those later, Laura. So thank you for sharing. Like I said, Laura is a patient partner and helps us with our studies. She's participated in our studies and she's a real advocate to help others with PCOS as well. So thank you, Laura. So let's move on to Letisha, who's our resident registered dietitian tonight. And Letisha's going to present a case study and also explore her ways of helping women in their nutrition challenges in PCOS. So thanks, Letisha.
Yeah, you are welcome. So yeah, I'm Letisha. I'm a dietitian. I'm really passionate about PCOS. So we're going to go through, exactly, just kind of my case study in terms of a client that I had, what we worked on, what she was struggling with, and kind of her own journey. So, and again, this is just going to be an example. It's not meant to replace any medical or even dietetic advice that you might be getting from your own healthcare professionals, but essentially, we always start off with an initial assessment, and I review medical history. So for Polly, it was PCOS and eczema, but I'm always screening for things like eating disorders or even sleep apnea, things like that can be comorbidities for PCOS. So that's always something that I'm kind of keeping in the back of my mind. Polly didn't struggle with that. Then I always review someone's diet history. So many women, actually with PCOS or not, but definitely with PCOS, tend to have a diet history where they have lost and regained a certain amount of weight multiple times over in their life. And that is something that is really important for me to know, because it can help me set a little bit more realistic guidelines, because that can impact future weight loss down the road. So for Polly, I think it was about 40 pounds that she had lost and regained 2 times over since high school. So then in terms of symptoms, I always review that for a client, just because that actually does impact how I would help someone with their nutrition. So for her, she had some pretty classic symptoms, including severe sugar cravings, kind of a disconnect from her body in terms of her hunger and fullness cues, irregular period, as well as weight gain. She was actually playing high school basketball, so she was pretty active and didn't really seem to make much of a difference. She continued to gain weight. So here we go. So then another piece that I'd like to review is someone's habits. So these are some things that Polly was currently struggling with. And this is really important because this is what we're going to target in terms of skills and habits that will improve her ability to reach her goals as well as maintain them. So we'll get into a little bit more of why I would be looking at that in a couple other slides, but I also include preferences, values, and goals. So preferences, that could be like, she doesn't want to eat leftovers for more than 1 day in a row. Cool, that will be included in the plan. So meal cooking, like batch cooking meals, probably not going to work for her. She's not going to like it. So then, of course, things like values is super important. So she was a huge value of her was family. So if I was to say, okay, you need to be going to the gym for 2 to 3 hours every single day, you will miss family events, probably not going to work for her. So here are some things that I really like to take into account when building a plan. Before we get into the specifics of the nutrition piece, I really like to focus on the driving factors of PCOS. We want to try to break this cycle or reduce it as much as we possibly can. So we're going to try to improve insulin sensitivity, lower testosterone levels, and improve either stop weight gain, some weight loss, and improve some inflammation so we can kind of stop this cycle from getting a little bit worse. It's actually pretty much like Laura had mentioned, it being like an ecosystem. Yeah, we want to improve all of these levels, not just one thing. So this was already mentioned, which is really good. The best diet for PCOS does not exist. So we very much try to just tailor some of these broad recommendations into what can work for the individual. And I will get into a little bit more about what I like to focus on. So blood sugar balance, right? This is very important to prevent that worsening of insulin resistance and then potentially higher levels of blood sugar down the road. So when I'm talking about blood sugar balance, that could be what types of food someone's eating. So that's going to be a difference between whole foods and highly processed foods, things that are higher in sugar. The amount of food, when you're eating, but then also kind of how you're spacing your meals throughout the day, all very much impact blood sugar balance. There is no specific macronutrient breakdown for women with PCOS, unfortunately. This is also something I tailor very much to my clients because, you know, I could have someone who's working out a couple times a week. I could have an ultra endurance marathon runner with PCOS. It really doesn't matter. So those macros are going to be very different. However, in general, I do find my clients with PCOS tend to do a little bit better with moderate carbohydrates, so not low, not no carbs, as well as a little bit of higher protein and moderate fat levels. But again, very much tailored towards the client. Eating enough. This is very, very important. Many of my clients are actually very surprised that I recommend them to eat more foods rather than completely cutting out food. We'll get into that in a little bit more detail, but that very much impacts things like cravings, portions, a lot of habits that people are concerned about. Making sure that they're eating enough throughout the day or the week can prevent that compensatory eating later on after work or on the weekends. Then whole foods, of course, this is very important because when we have foods that are minimally processed, they're closer to their natural form, that does improve things like blood sugar balance, appetite and cravings, improved satiety or that level of fullness, as well as even things like inflammation. So, and actually in Polly's case, when she prioritized a little bit more whole foods, cooking at home, her gut health and eczema very much improved. So that could be related to PCOS, that might not be, but that was something that she had found. So this is something that happens quite a bit. So if you don't eat all day, your cravings are pretty high, or you tend to be starving mid-afternoon or evening. Maybe you get home and you have large portions, less healthy food choices, and then you feel out of control around food, which then usually either you're not hungry the next day, or you kind of commit another vow to never eat those foods again, or I'm going to diet all day tomorrow, and the cycle then repeats itself. So this is what I mean by making sure you are eating enough. So nourishing yourself throughout the day or even the week so that this compensatory kind of pattern doesn't increase your cravings and your appetite in the evening or on the weekends. We truly do live two different lives when the weekend comes around. So ideally, if we can kind of stabilize things throughout the week, usually people find that they're in a much better place, appetite and craving wise. Then kind of a summary. Usually here are some core things that I end up working with clients on. Now, again, these are kind of tailored towards the person and exactly how we might go about doing that is in an individual basis, but avoiding skipping meals. So trying to eat 3 meals a day, maybe 0 to 2 snacks, very much dependent on the person. This very much helps blood sugar balance because no matter who you are, if you don't eat all day, go to Olive Garden, have a larger meal, your blood sugars are pretty much, it's going to spike very, very quickly. Our bodies break down carbs and our insulin levels are a little bit more well managed if we're spreading it out evenly. Avoiding naked carbs. So trying to pair any of our carb choices with some protein and some healthy or some healthy fats. So that would be like the difference of, instead of having an instant oatmeal packet in the morning, maybe you add some berries and some eggs on the side. That's kind of the naked carbs piece. Choosing low glycemic carb index carbs more often, or higher fiber carbs. So that could be as simple as switching out white bread to whole wheat bread, or white pasta to bean-based pastas, or even choosing more high fiber carbs, you know, rice, brown rice, quinoa, farro, corn, starchy veggies, all that wonderful stuff, as well as emphasizing those healthy fats. So that could be, if you're not allergic to fish, having some fatty fish, but things like olive oil, nuts and seeds like walnuts or chia seeds are all very good sources of healthy fats that can kind of cool that inflammation, but they also have a really good benefit of even things like mental health. So really good foods. Starting your day with a high protein breakfast. So I recommend at least 20 grams or more. If someone is blessed with the gift of height, their chances are they're going to need a little bit more as well. So those are some things that we would be working on. I do find that women who start their day off with a high protein breakfast have a little bit more energy, and that chronic fatigue that comes with PCOS can be very frustrating, as well as things like decreasing cravings later on in the afternoon or evening. Of course, eating more plants. I am a dietitian, so you guys knew this was coming at some point. That could be something like 50% of your plates at lunch and supper being veggies, and ideally some non-starchy veggies. So starchy veggies like potatoes, whereas a non-starchy would be like leafy greens, or including more plant-based proteins. Tofu, beans, lentils are all super high in fiber as well. And then cooking more whole foods at home. We already went over that. Those are kind of the basic nutrition habits that we really want to work on, but exactly where someone takes this and what it looks like is going to be very different from person to person. Which foods should I avoid? Well, there are no good or bad foods. A phrase I really like to teach my clients is that you can eat anything. You're an adult. You can eat whatever you want. But maybe not everything, and still reach your goals. So if your goal is to manage your blood sugar, your diet really can't consist of a lot of sour gummy worms. It's not going to do well for your blood sugar. But does that mean that they are bad and that you can never have them? Absolutely not. So a little bit of that phrase, you can eat anything you want, but maybe not everything and still reach your goals. So there is actually, on a side note, there is no solid research that women with PCOS should avoid gluten or dairy. This is actually something that I work with clients on a case-by-case basis based on medical history and symptoms. So for some people, avoiding them is going to improve their symptoms quite a bit. And for others, not necessary. So that's something that we work on together. Then, of course, relationship with food. So I don't have time to really dig into this, but this is something that's super important because most of my clients know what they should be eating. Vegetables is not a surprise to them. However, if we don't really connect that knowing to the doing, chances are this is just going to be another fad diet. Not a fad diet. It's just going to be a short-lived diet. We want to really connect some of the knowing to the doing. So a little bit more in the craving management. So on at a physiological level, women with PCOS are going to have higher cravings. And that is something that we can improve. It may not fully go away. However, I like to look at cravings from three levels. So one is the physical, so bodily awareness. If someone can't really tell what a gentle level of hunger or fullness feels like, they only know what starving or 10 out of 10 full feels like, that's going to be something that we work on. The type of craving, is it head, craving, or is it like a stomach craving? Those are going to be super important to kind of weed out how someone's eating. So are they eating mindlessly? Are they eating really quickly? Those are going to be some things we're going to address. The nutrition piece, I already talked about how those relate to cravings. And then the emotional. So one would be the awareness, building that awareness of your emotional health or what your triggers are, because that's going to be different from person to person. And if it's not related to anything that is out of my scope, we would work on some better coping skills. If it is related to something that is out of my scope, then that's when a referral to a psychologist is super important. And then, of course, incorporating their values and goals. And that's really just because if your actions are in line with your values, or your goals are in line with your values, it's going to make that commitment to the plan a little bit easier. But this is kind of more than one reason for having cravings. And if we look at it from more than one perspective, we can really decrease the severity, whether they are still around or not. It's very different. It does depend on the woman and her PCOS. So, but essentially, there's more than one way to deal with cravings rather than just saying you can never eat a certain food. Lifestyle, super important. If someone's very stressed, they don't have very good sleep, and they're not active, these are going to make some of the symptoms of PCOS work. But again, in terms of how someone does this is very, very, very different, as well as the activity. There is no best activity for women with PCOS as well. I've seen things online where some people were recommending that women with PCOS avoid high intensity levels of activity due to increasing inflammation levels. There's really no research to support that. However, I would agree that if someone's like not eating, skipping meals, going crazy at a boot camp, and like going to a gym for 2 hours, chances are, yeah, their symptoms of inflammation will very much increase, but it's more than one factor. So I do work with some natural health products and supplements. However, I do recommend them on a case-by-case basis. So that would be something like inositol or NAC, berberine. But again, I can't really have a blanket recommendation for women with PCOS because it is very dependent on them. If you are interested in trying out any of these, I do very much recommend you talk to a doctor and or your pharmacist, because natural health products do have, sometimes they're not great for a certain condition, and sometimes they're not great if they interact with your meds. So super important you get that a second opinion before you try something. Then of course, I coordinate with other healthcare professionals and really help them try to navigate some of those healthcare systems. Oh, sometimes a personal trainer, I didn't add that on here, but those are some of the people that I would help them kind of figure out what are some unaddressed issues of PCOS, so that we're looking at this from the whole perspective of the condition, not just let's say fertility or something along those lines. So again, kind of a case-by-case basis. But after all of that, which Polly and I worked together for about 9 months. So after all of that, she had better improvements in her PCOS symptoms. So for her, it was definitely the fatigue that was a really big thing, and her cravings had decreased. I have a body composition machine, so we knew that she gained muscle and lost fat, as well as some weight loss, better cholesterol levels, and her gut health was a lot more stabilized too. So that's kind of what she was looking for. Now, you don't have to, you can improve your PCOS symptoms without losing weight, but weight loss, even in 10 to 10%, can significantly improve those PCOS symptoms as well. It does not mean you have to be a certain size, like at all, but it does very much improve some of those symptoms. So we do end up working with a little bit of weight loss as well to help the PCOS symptoms. References, if anyone was super interested. And yeah, that's it.
Thank you, Letisha. So now what I'd like to do is maybe open for questions. I've seen a few of the questions in the chat, Mish. Do you want me just to address a couple of those? Laura, there's a question for you about specific types of exercise that have helped you.
Yeah, so I've done different types of exercise. I don't I think what's really helped me is probably elliptical work mostly, just because it's a little bit lower impact. It's not running, so to speak. Walking is really helpful for me too. I'm very aware of, activating muscle work versus using high intensity weights or anything like that. It's really cardio has been really important for me in particular. That's really helped me. I can't say I enjoy it, but it's definitely helpful. The other thing I actually really enjoy too is I do enjoy yoga. So that's been really helpful for me too. I think that kind of gives me a little bit of that mental, emotional relaxation, as much as being able to stretch joints and open up your body and get yourself some more kind of flexibility, so to speak.
And yoga, you can work up a sweat, Laura.
Yes,
You
it's
can
true.
Really, raise your
True.
heart rate. Yeah. Letisha, do you have any other comments about exercise that you've experienced with PCOS?
Yeah, really at the end of the day, in terms of changing body composition or like better metabolic health, I'm always going to recommend a mix of cardio and strength training. That's the ideal though, based on the research. When I'm talking with a client, the best activity is going to be something that they enjoy or tolerate. And that's kind of, what are you willing to do consistently? That's going to be the biggest thing.
Yeah, and I think the muscle mass and doing weight bearing exercise actually helps with your muscle, which your muscle actually burns more fat than your fat mass or your fat adipose tissue. So building your muscle mass and doing some form of weight bearing exercise, even a small amount of body weights can help, or even just weight bearing exercise. That's what we've found. There's another question on religious reasons. Maybe Letisha, you can answer that.
Yes.
How do you manage someone who has, religious fasting?
Yes. So let's say someone has the religious fasting. In terms of, I would 100% support them in their faith, and I would definitely not try to get in between them. It would just be a little bit more of kind of having that discussion. If someone because I think for some people with Ramadan, if you have like diabetes or you're pregnant or things like that, there are some kind of exceptions in terms of who can not fast, which very much depends on, I guess, their symptoms, what someone else is struggling with. If they're like, okay, actually, I do need to also do this for my health. That's kind of a value-based discussion, as well as the symptoms that we may or may not be worried about. However, it very much then depends on, how long is this fast, and is it until how long do you have to eat? Because sometimes I know it can be kind of a really wonderful feast at the end of the day, which can exacerbate some of those symptoms. So then maybe we would have to be very a little bit more on top of the meal planning, the quality of food that they're having later on, to minimize some of that blood sugar spiking. That one, it's kind of hard to answer that one without a full-on kind of assessment of a client.
Yeah, it could be very individual. There's another question. Also, if you've got any questions for Dr. Ghosh, our endocrinologist, she's also around and available as well. There's a question about recommendations for acne. So I'll address this pharmacologically, and Dr. Ghosh may be able to comment as well. But there are anti-androgens that can be used to address symptoms like acne, body hair growth, and other symptoms of high testosterone. So also a dermatologist could be consulted as well. But Letisha, do you have any comments for diet and acne that you've found?
Yeah, so in terms of dairy is a big concern for acne. The big one would be low, like skim dairy products, or 0%, actually have a higher risk of causing acne or are linked to acne in comparison to whole milk fat products. So for some of my clients who really love dairy, we would switch to whole fat. Of course, monitoring the portions. Maybe it's just like a whole fat milk latte that they have instead of a lot of dairy throughout the day, and cut all the skim and see if that helps. If it doesn't, we could remove dairy as well. Then, of course, anything that spikes up your blood sugar, makes your insulin resistance worse, is going to then impact your testosterone levels, which can then further acne. So acne development. So we'd want to tackle that a little bit holistically too.
Yeah, and acne could be symptom of some food allergies too, correct? Yeah. Dr. Ghosh, could you address the acne question as well?
Yes. So the acne, I didn't read the question exactly. What was the question?
It was just recommendations for acne.
Recommendation. Okay. So really, first of all, it depends on the age of my patient. When I see my patient, if my patient is relatively young or adolescent, around let's say 17 to 20 years old, sometimes it's just the hormonal changes as the body becomes adult. Acne can be too much, and sometimes we don't even have to do a lot. I agree with Letisha that there is some studies with dairy and milk product. Not that, I make those recommendations myself. From medication point of view, having the face clean with gentle cleanser, and I have got it from my dermatology colleague. Not that I have any association with Cetaphil, but my dermatology colleague tell me that Cetaphil cleanser, they work very well with acne. And now I tell my patients that use that. From medication point of view, a combination of estrogen with anti-androgen. So estrogen actually, it can either exaggerate or make acne better. So it is almost a trial and error. Most of the patients with PCOS, with acne, it does improved with oral contraceptive pill and all those combination. If it is not, then we take help from our dermatology colleagues who can use other things. And topical vitamin A preparations can also be useful, although I don't prescribe that as an endocrinologist.
Thanks, Dr. Ghosh.
Thank
There's another question about milk and dairy, and Letisha addressed this a little bit. There's not a lot of research on milk and dairy in PCOS, but like Letisha did mention, in actual fact, it can promote satiety because of if you have whole fat dairy, because of the fat content. And there's good fats in dairy that can be anti-inflammatory, again, promote that satiety, and part of a well-balanced diet. And if you have an allergy or something, that's different. But if you can use milk and dairy as part of a balanced diet, it is recommended in general population guidelines. But maybe, Letisha, you might like to comment further.
Yeah, specifically, I haven't seen research about the tumors and PCOS as mentioned in the question. That would be something I would have to look more into. But yeah, I agree with Dr. Vine in the fact that it's mostly the higher fat dairy products have so many health benefits. You might feel fuller and more satisfied after having them. So there's nothing wrong with having any of them. It's just based on someone's symptoms. Kind of, we would have to talk about the how much piece.
The other thing with some of the yogurts and dairy is they might have a lot of added sugar. So a small tub could have like 50 grams of sugar, or 20 to 50 grams. So choosing dairy products that don't have added sugars, that are more natural, is also a way to go if you really love dairy. Laura loves cheese, but obviously I love cheese too, but you have to have it in that smaller portion. Don't eat the whole block, just have a small amount to meet your satiety or meet your needs for that cheese as well. There is a question about, this is probably for Letisha, how do you focus on weight loss without becoming obsessive?
That is a definitely a tricky thing to do. In terms of how I help clients take weight loss without becoming obsessive over it, is mostly focusing on the habits that you have control over. And looking, so for example, instead of saying, I'm going to lose 10 pounds this month or X amount of pounds this month, that's the outcome. We want to focus on the behaviors that you do have control over. So maybe the goal is, I'm only going to eat out or skip the dishes once or twice a week instead of maybe the 3 to 4 that I was doing. Focusing on the habits, the things you do have control over, is way, way, way easier on the brain, because that is something that, yeah, you can also get the reward of achieving those goals. We don't have direct control over whether someone can lose X amount of pounds in a week or X amount of pounds in a month, unless you are willing to, I would say, side story, some of the combat athletes that I work with, yes, I do have that, like, you can lose the X amount of pounds before your weigh-in, but they don't want to maintain it. They're going to be 10% heavier by the time they get back in that ring. So it doesn't really, they're not a lifestyle change. So of course, yeah, focusing on the habits you can control. Sometimes taking a break from the scale is very, very helpful. And then focusing on those non-scale victories. So most people want to lose weight for a reason, whether it's for energy, better mobility, something along those lines. So if you are feeling like you have more energy and the scale hasn't dropped yet, you are winning. So really trying to focus on those non-scale victories as much as you possibly can. Those all very much reinforce weight loss down the road. We just can't very much predict how much and in what timeline.
Thanks, Letisha. I think this is a question for Dr. Ghosh about connecting with a fertility specialist.
Yeah, that's a good question. And I'm glad it came up, because a lot of time I do see patients who have seen many physicians and have got medication for fertility. So number one thing for PCOS with fertility is establishing that the fertility is for polycystic ovarian syndrome and not for other disease. So endocrinologist might be a good place to start for our female patients. But when the partner there could be male factor, then we suggest reproductive endocrinology. And there is a clinic in Royal Alex Hospital, which is AHS funded, and they do workup for both male and female partners. And there is a private fertility clinic in town who is not, AHS does not pay for all their services, but workup and everything could be done in that reproductive endocrinology clinic in Royal Alex Hospital. I hope that this was the answer you were looking for.
Thanks, Dr. Ghosh. There's also a question. Oh, sorry.
Sorry, I just wanted to say that it is not self-referral. So the patients have to be referred by a physician, and family physicians, they refer to those clinics all the time.
The other question is, what is considered high testosterone? So in the diagnostic criteria, high testosterone, there's total testosterone and there's free testosterone. And actually, the high levels are what help us define what we call the biochemical hyperandrogenism or PCOS. But I'll let Dr. Ghosh answer that in more detail. What is considered high testosterone?
So if you ask a checklist in Alberta, our upper limit of normal for a female patient is 2, and that is the biochemical abnormality. As an endocrinologist, we might not actually look at the number that carefully unless it is more than 4 or 5, because then we are thinking about other causes of high testosterone, not polycystic ovarian syndrome. But Dr. Viney brought a very important point, that is just a biochemistry. There are a lot of people with polycystic ovarian syndrome, they actually have a normal testosterone level when we do the lab test, but they do have manifestation clinically, which are from high testosterone. It just tells us that the lab is not a perfect tool for anything.
Yes, and there's research that shows that in some PCOS patients, they have an androgen sensitivity. So they have normal androgens or testosterone, but they just have increased sensitivity to androgens. There's also a question about pharmacological intervention for the high testosterone, which I think you answered, Dr. Ghosh, but did you want to add anything else to pharmacological intervention for high testosterone?
Yeah, the answer is that I often get asked from my patients that, oh, I had high testosterone and we have done this, and we are feeling good, but I have never checked my testosterone if it has become normal or not. So the answer is that, we don't monitor the testosterone level to see that whether it's getting normalized or not, because we have accepted that right now with all the information we have, polycystic ovarian syndrome is a chronic disease, and testosterone probably will be either high, low, normal, but it is not going to change any health outcome. So there is no specific targeted therapy for high testosterone.
There's also another question on PCOS specialists. Obviously, you can get a referral from your family physician to any endocrinologist, but Dr. Ghosh, did you want to comment on that?
So yes, again, polycystic ovarian syndrome. In this room, we have so many people who have polycystic ovarian syndrome, and all of us, we have different concern about our health. So it really depends that what is our concern. So family physicians are a good place to start because they will be able to help us sort out with specialists. Endocrinologist, we are involved in the hormone management and maybe a bit of workup of fertility and so on and so forth. And then we have started to work a bit on cardiovascular risk. There are few endocrinologists who have special interest in cardiovascular risk, but I would suggest that start with your family physician. If fertility is an issue, it's our fertility clinic. In addition, many gynecologists, they are very comfortable in treating people with polycystic ovarian syndrome. So there is a whole lot of specialists who can help.
Thanks, Dr. Ghosh. There's also a question about a vegan omega-3 supplement. We have information about those on our website because we have done official omega-3 supplementation. So that's on our website. But Mish or Laura, if you wanted to put in the chat what omega-3 supplement vegan that you're using, that would be helpful. Another question is about partners and collaborators in the US. We actually are part of the Androgen and Excess PCOS Society and do collaborate and keep up to date with all that's happening in research in the US. Just for you all, so you know, the National Institute for Health in the US recently hosted a very specific PCOS and cardiovascular disease forum, which we were involved in. And so, yes, we are trying to collaborate and work with those in the US as well. Another question here is a link between PCOS and hyperpigmentation. That's probably a question for you, Dr. Ghosh.
Is there any specific hyperpigmentation that the question is about, or just hyperpigmentation?
It just says hyperpigmentation. Amali, if you wanted to put more information, maybe Dr. Ghosh could answer that. There is hyperpigmentation in PCOS. It might depend on the location as well.
Right. And the obvious one is called acanthosis, which is a clinical sign of insulin resistance. So people who have very high level of insulin in body and insulin resistance, we can have thickening and velvety texture of skin in few areas, for example, around the neck area or underarm area. So that's the most common hyperpigmentation. So when we see people in clinic, we are always checking for that. So yes, it can be associated with hyperpigmentation. And one interesting thing about this hyperpigmentation is that if patients are able to lose weight or in some way their insulin resistance improve, the hyperpigmentation also can improve.
Good to know. That's good advice too. I also have a question about thyroid issues linked to PCOS. Again, I know Dr. Ghosh will rule out other endocrine issues related, but do you want to comment on thyroid issues and links to polycystic ovarian symptoms?
So when we establish a diagnosis of polycystic ovarian syndrome, we make sure that we check the thyroid hormone level. And the reason is that many symptoms from thyroid hormone abnormality can actually look like somewhat polycystic ovarian syndrome. And the most common is the menstrual irregularity that we can have with PCOS. Now, is it high? I'm not too sure that if it is that high, we're definitely screening, so it might be detected. Hypothyroidism and hyperthyroidism both are very, very common in younger people. So as we are screening people, we will detect abnormality, but I'm not aware of a direct correlation that if there is any high amount of thyroid disease in people with polycystic ovarian syndrome.
Thanks, Dr. Ghosh. I think we answered the question about going to your family physician first and getting a referral to an endocrinologist. They really can help you with your diagnosis and all of that hormonal care and symptoms. There's some suggestions for Nutrici, Nordic Naturals for the omega-3s, and also Freshfield. That's from Laura as well. So there are some other sources of omega-3s there. We've also shown omega-3s help with lowering your triglycerides and blood lipids, so they can be beneficial. There's also evidence they can improve androgens as well as part of a balanced diet. So they do have their benefits, that's for sure. Also, any dermatological aspects associated with PCOS as well, we've seen them can help as well. There's a specific question, should I be specifically looking for when choosing an omega-3 or fish oil? So it really depends on whether you want to have a vegan omega-3 or the fish oil has the long chain, 22.5 and 25 fish oils, which are really important for specifically blood lipids, and they can be found alternatively in other marine sources or other algae sources, which are not a sort of more vegan sources. So you can find them. Any other questions? It's nearly 20 past 6. If we,
I was just going to add.
Yes.
Some of the fish oils or the omega-3s, they'll say something like fish oil or omega. It'll be pretty vague. Ideally, looking at the back of the label for something that at least has 1,000 milligrams of both EPA and DHA. Those are the two types of omega-3s we really need, and our body doesn't really produce it, so we really need to get them. And sometimes if you look at the back, it'll be like omega-3s or something, or omega, and then you'll look at it and it'll have like 400 milligrams of both EPA and DHA. That's not going to be a very potent supplement or what I would consider worth your money. So that would be the one big thing, but you do have to turn it around and look at the small print on the back.
Yeah, the dose is very important. So in our fish oil study, for example, we use nearly 6 grams a day for 3 months just to lower blood lipids. So you do need that higher dose, and good brands will have the higher dose, purified doses of those omega-3 fatty acids. There's a question about treatment of hirsutism, which is about high androgens and other hirsutism symptoms of PCOS. Dr. Ghosh has actually answered that already, and we'll address that when we do our frequently asked questions. We'll address that again. But Dr. Ghosh has already answered that. I don't know if you wanted to add anything, Dr. Ghosh, about treatment for hirsutism.
The only thing I would add is that the pharmacotherapy is not really effective for hirsutism. So a combination of estrogen, so oral contraceptive pill, with anti-androgens, spironolactone, and topically or locally, if there is any local hair growth on face, there can be an ointment which is called Vanica, which can be used. But ultimately, the mechanical ways of hair removal are the best. So laser and epilation, unfortunately, medications do not work really well. It can help a bit.
Thanks, Dr. Ghosh. So I think we're rounding up. We don't have many more questions. I'm just going to do some take-home messages from tonight. If I can just do that with all of you and share my screen. Can you all see that? So just some take-home messages. PCOS is a really complex hormone metabolic disorder. As you've seen from Letisha, and I've been quickly writing down some of Letisha's notes, nutritional assessment is really important. Diet intake, eating habits, your medical diet history, your preference, values and goals, all of those are assessed when you see a professional, a registered dietitian or nutritionist. And remembering that your PCOS and your symptoms are really unique, and you need individualized, a whole care approach to meet your health and nutrition needs. And this could be simple changes in diet to multi-interventional approaches, so nutrition, pharmacotherapy, counseling, which we've heard tonight, and then healthy, nourishing food choices and eating patterns. And you saw Letisha addresses blood sugar, your macronutrients, eating enough, whole foods, and also addressing relationship with foods, craving management, and lifestyle, so sleep, stress, physical activity. And I think what we've also heard tonight is, seeking and advocating for referrals to a range of different health professionals, to help you with nutrition and health, a dietitian, a psychologist, exercise coach, EMDR therapy, etc., and an endocrinologist can all really help you. And it's not one size fits all. You might have to go to several different health professionals to get that advice. I just wanted to finish by saying that we really need more response from for our survey on understanding health and healthcare. If you have a chance to do that survey, that would be great, and put your input into that, because we really need to understand our current healthcare system for women with PCOS. And then just thank you to everyone. Thank you to Laura for your wonderful story and insight over your journey with PCOS. Also, thank you to Letisha. And Letisha gave her contact details. We can also post those contact details later to get in contact with Letisha and her dietetic services. And also Dr. Ghosh, thank you for attending, and you got lots of questions for endocrinology, which was great. And also thanks to our teams, Stara, Mish, and Eden for attending and helping tonight. Thanks to everyone for attending. We hope it was helpful. We'll post some the questions and answers on our website later, and this recording will also be available to others that couldn't attend. Thank you, everyone. Really great to see you all, and we'll hope to hold another forum. If you have any ideas or want to give us feedback, please email us or just leave a note for us. Thanks so much. Bye, everybody.